So how has health-related home care contributed to the success of our hospital? At Abbeville Area Medical Center, our mission has always been to improve the health of the communities that we serve. And one way we do this is providing services to the community that we feel that they need. One of those services is home health care. When a hospital stay isn't necessary, or when a patient needs home health following a hospital stay, we know that we can rely on the aides, nurses, and therapists at Health-Related Home Care to provide excellent care. That's something that we, both Abbeville Area Medical Center and Health-Related Home Care, pride ourselves on, providing personalized, compassionate, professional care to our patients. Our patients aren't a number, and we treat both them and their families as if they're members of our own family. Because health-related home care is a part of Abbeville Area Medical Center, we're able to provide a very seamless approach to health care. We're a small organization, so our staff members know each other. We're a team, we collaborate. And when health-related home care doesn't have the answer, the hospital does, and a physician is just a phone call away. Bottom line, health-related home care has been providing quality, compassionate care to 5 communities for more than 16 years. They have great customer satisfaction ratings and great outcomes. They've also been ranked in the top 25% nationally of home care agencies for the last 5 years. Because it's about the patient, it's about their needs and about their care. Health-related home care has improved the health of the 5 communities it currently serves, and I'm confident it can improve the health of the Edgefield community as well.
I can't express to you the gratitude that we feel for the nurses that helped take care of Caroline when she was so sick. I remember leaving the hospital and she had just turned a year old. And here was my petite little baby with this tube sticking out of her, and it was quite frightening, to say the least. When we got home that evening, I just remember the relief watching the home health nurse pull up in our driveway. She was so patient and was very thorough in explaining everything to us. She helped us administer Caroline's medicine through the tube that was in her chest. And we were so concerned that she would pull that tube out, and we were also scared being her primary caretakers because from a medical standpoint we didn't have any training, and so she was just so patient and thorough and said things over and over until we felt comfortable that evening, because we had to administer the medicine several times a day, and each time it would take a long time, and it was a challenge keeping a 1-year-old still for that long, and she was just very compassionate. But you know, there were times when we would call them and they would call us back right away or stop by to check on us, and then there'd be times they would just call in between visits just to check on Caroline, and we really appreciated that. But if we ever had a question, they were there for us, and that was just so comforting once we left that hospital setting. And as you can see, Caroline is no longer 1. She's now a healthy, vibrant 4-year-old, and we'll always be very grateful to the healthcare office for all that they did and their entire staff for us and our whole family, right, Caroline? Right. They helped take care of you. So we appreciate everything they did.
I would like to say they are angels. They have really made a difference in my life. When I was in the hospital for 15 days, when I came home, they came out and set up my house where I could function real good. The nurses, the physical therapists, they all worked with me. They gave me strength, helped me to get my strength back in my upper part of my body and the lower part of my body. They are just really angels. And if it wasn't for health-related home care, I don't know where I would be.